Hi, this is Dr. Nick. I'm the Incrementalist here with insights for better business and better health. This week I want to talk about a couple of papers that have come out. There's some CDC guidance that talks about the clusters that have been shown to occur, I think predominantly in Japan, but there may be some other additional countries. And it's offering us some helpful insights as we think about how we open safely and deliver a safe environment for our employees, safe environment for our customers, and safe environment for visitors. And what essentially came out of this is confirms everything that we've talked about before in terms of the virus and its exposure and who gets sick. And it really comes down to two factors that you have to think about all of the time. It's the viral load, so how many virus particles you're being exposed to, and the time that you're being exposed to for those virus particles. So viral load times time of exposure. And what we're seeing in those papers is that in enclosed spaces, that's causing problems. And that's especially true if those enclosed spaces, the individuals that are in them are not wearing any form of face masks or face coverings. And here's what's going on. These face masks, even the cloth form, are actually helping stop the virus from emerging from people that are infected. So if you move inside, it's really important that part of the guidance that you're requiring of your employees, requiring of your visitors, customers, includes that they wear a mask. They wear a mask or a face covering to protect everybody else. So if you have the disease, you may not know it for several days. You may never know it because you didn't get tested and you had no symptoms. We see that in many instances, in quite high numbers in some of the studies and experiences on board ships, specifically the aircraft carrier. So to reduce that, everybody needs to wear a mask. So the employees clearly need to protect their customers and their colleagues, and also the visitors and customers that come into properties. Now, the other thing that came out of this that I think is important is that it wasn't just exposure inside, but it was exposure inside where there was an increase in the viral load. And this was centered around gyms, churches, where there's exercise, where we're breathing heavily, or in the case of churches, you might be singing. That actually increases the spread of the virus when people have the disease, may not know it, and in those cases, those activities will increase the amount of virus. Remember the calculation, virus load times duration of exposure. And if you bring that into the indoors, so you're in an enclosed space and you're not taking that air away in an effective manner, then you've essentially increased the risk of those individuals. So this is a little bit of a struggle because for gymnasiums and exercise facilities, we essentially are inducing an increased respiration rate. So in that case, we really need to be thinking about including a face covering or mask recommendation. And I have to say, I know that's challenging for people because it restricts airflow. It makes it a little bit harder. But as my colleague Fred Goldstein pointed out, that's actually one of the training methods that are used. People wear face masks to restrict the airflow to improve your lung efficiency. I know it's going to be something that's going to be challenging for people to get used to, but it's certainly one of the things that I think are going to be important as we try and move things inside. Now, if you're outdoors, this guidance doesn't necessarily apply if you've got physical distancing. So you're exercising outdoors. That's what's happening at my local gym. It's great. There's a breeze. We can exercise. We're physically distanced, and the need for masks less important because that exposure is not in a confined space. The additional interesting element to this is around aircrafts and travel, and there's some good studies that date back actually some period of time that show the spread, and it tends to be limited in very focused areas around an individual with localized spread. But here's what's important about that. In an enclosed space in a setting where there's not a lot of activity, so for a classroom, this is different. So to be clear, I'm not suggesting, and the guidance is not suggesting that you don't wear a mask, but in this case, a lower risk activity in an enclosed space where you're not speaking or talking. So in the case of a plane, I don't know about you, but I tend not to talk to folks. Quite often would be watching movies or reading, doing something like that, just breathing normally. So I'm not increasing the exposure if I had the disease, so I wouldn't be spreading it around me. Whereas in a gym, I am increasing it. So two different risk settings. So actually the risk in this enclosed aircraft would be less than being in a gym where people are breathing heavily and breathing hard from an exposure from somebody that has a disease. Clearly, where we'd like to get to is to know that somebody has the disease before they even show up, to be able to confirm that with certainty. That's going to require some better testing strategies, some techniques, and obviously to scale all of that up. Until that time, we've got to think about mask or face coverings as an essential element to everything that we do as we get people back to work safely. I'm Dr. Nick. I'm the Incrementalist. If you've got questions, please reach out to me directly. We've got services around that for businesses and for educational facilities and indeed gymnasiums. If you're interested in finding out more, reach out to me directly in the link below. I'm Dr. Nick. I'm the Incrementalist, here with insights for better business and better health.